Good morning, YouTube, and welcome to another seminar hosted by PCI Healthcare and Consultants of Texas, located here in Cedar Hill. I just wanted to actually go over with you again about contemporary and alternative medicine, which is referred to as CAM. This course is actually entitled Alternative Therapeutics in Nursing Services. You do not have to be a nurse or a healthcare professional to attend the seminar. The syllabus is actually located on our website, www.pcdiwg.webs.com, and I will have it posted at the bottom of the video so that way you can follow along. Again, as a disclaimer, um, if you are under doctor supervision, before using any of the information that is shown here on video or that is shown on the web, please advise your physician of what you are doing. So that way you and your physician will be on one accord with your care plan. Thank you. I do have a few things here for you. Again, the syllabus can be found on the website. Let me give you a few uh, a little information about CAM. Okay, contemporary and alternative medicine. These may include naturopaths, which is like myself. We believe in healing the patient with nature. Nature will heal the patient. That includes sun baths. That includes water baths. That includes um, herbology, nutrition. These all are combined together to help the patient to the better. You have homeopaths, which believe in giving a patient a little poison because, as it said, homeopath is defined as um, similar illnesses or similar diseases. So, and it is strongly recommended in homeopath that if you are um, picking homeopathic type remedies, please, I do advise you to go to someone that actually knows what they're doing and not somebody that just working a summer job. So, again, please be advised. You need to go to see an actual homeopathic physician or a naturopathic physician that can be able to guide you. Because homeopathics, like I say again, is just a little poison. For example, atropine, which is deadly nightshade. We use the deadly nightshade to cure the patient, and that's by several drops. And those drops have to be calculated to precise in order to cure the patient. It gets better in herbology. The sickness gets worse before it gets better, and that's how we know that it's working. You got chiropractors and physical therapists. Chiropractors believe um, in order to bring a patient back to wellness, if you actually align the spine cord, then the patient will actually, the immune system will actually boost to where the patient will get better. Physiotherapists, on the other hand, believe that um, they are mostly dealing with joints, large joints, and extremities. They are whole body therapists. So just remember that one. It is said in the past, in the mid 1800s, 1900s, you have to excuse me, I am looking at my notes just to make sure that I keep on track and I do not repeat myself. Back in the 1900s, um, when allopathic medicine actually started to surface, a lot of the physicians were thrown in prison, or the practitioners were thrown in prison for practicing medicine without a license. It is now said in California that has changed to where uh, California, Washington State, no, it's Washington, D.C., and some other states also have in place where they have a naturopathic board, and it's only 5 or 6 schools in the U.S. that you can actually attend medical school. There's 2 different types of naturopaths out there. There's conventional naturopaths, and then there's our naturopathic medical doctors, and then you have traditional naturopaths, which is like myself. Traditional naturopaths actually do not practice a form of um, conventional medication. We cannot prescribe drugs, but we actually prescribe nutrition. We actually prescribe herbs and supplements and vitamins to help the patient get better. And we also do a lot of education versus conventional um, naturopaths, which actually prescribe drugs because they went through 4 years of med school and were able to do a residency. Traditional naturopaths, some actually do corresponding courses, or they have learned or achieve a certain amount of experience to where they're actually able to go take a board exam. But most require that you at least have a doctoral degree, either from correspondence or you actually attend the school in order to be able to take the board exams. Um, Getting back to what I was saying about the background on CAM, um, a lot of the physicians were thrown into prison again for for practicing without a license. Um, these were called irregulars. Um, and the regulars was actually um, doctors that actually did an externship and went through a whole year of school in medical school, and that's why they were able to practice medicine. I do have a little basic terminology for you. An ND is a naturopathic doctor, in which I have explained. A RN, which is actually a registered nurse. We do have several ways how we are able to dispense medication as a naturopath. You have PO, which is by mouth, and usually our medications totally are calculated differently than conventional medications. Um, Ours may be, a naturopath may say, for example, I want you to take your medication early in the morning before the sun comes up. I want you to take your pulse rate late in the evening before the moon goes over. It's really quite different, and sometimes it's weird, and some people are, it's out of their comfort zone. But I do recommend that you at least go and take a 55-minute. Usually it's 45-50 minutes for them to actually go over a questionnaire with you, take your pulse rate, and actually find out what you are sensitive to, and be able to give you a medication or a treatment that will actually help you. We have also a difference in dietitian and nutritionist. A dietitian is someone that has completed at least 4 years of college at an accredited institution and have taken the ADA, which is the American Dietetic Association board. The only difference between a dietitian and a nutritionist is because a nutritionist actually goes over the whole body versus a dietitian is actually clinical. You mostly find them at the hospital or in other clinics. Nutritionists mostly work in health food stores, um, health clubs, because they deal with mostly supplements and vitamins and powders and some other forms of nutrition. And nutritionists are licensed. Um, some may not be licensed, so please beware because some they don't know what they're talking about, or just woke up one day and said they wanted to be a nutritionist because they lost 2 pounds. So I do recommend that you find someone, if you're going to go under the guidance of a dietitian or nutritionist, please go under somebody that has at least some form of education and a license to practice. When seeking any type of CAM professional, there is a governing body for somebody, um, such as acupuncturists. Acupuncturists actually have a licensed body, governing body, and they must be registered during the on the Texas Medical Board. So, or any other um, medical board out there, they must be licensed through that state because that is a medical procedure. And you can also look on the on my website and find those links there to where you can actually look up your practitioner and find out if he or she is licensed through that state or through that governing board. We do have some medication routes that we administer medication through as naturopaths. We have buccal, which is actually your cheek. There are some lozenges that we ask our patients to not to chew, but actually hold on the side of their jaw because you got fine capillaries there that actually absorb those medications much quicker and they get into the bloodstream much quicker. You have PO, which is by mouth. That means you're going to actually swallow the pill. Sublingual, which means underneath the tongue. There are some also lozenges that we can make as naturopaths or as natural practitioners that we ask our patients to hold underneath their tongue or in their cheek to where it will dissolve slowly, but it gets into the bloodstream a little faster. Naturopaths are not allowed to do anything by IV, so we won't even go through that. Now we do have optic, which are some drops. We can make ointments that we can make. We never make drops. I'm sorry, but we make ointments that we can put actually on the eye to cure maybe conjunctivitis, which is pink eye. There is ophthalmic, which is your ear. We do have oils or essential oils that we can put into the ear to cure an infection. And we do have other ways on curing the patient also through sun baths. We do recommend, it's kind of weird the way I'm going to say it, but this is the way how, as a naturopath, we are able to do sun baths. We have the patient to lay out in the sun, and either it's red, blue, or yellow. It has to be a specific color to cure a specific illness. Most naturopaths use it. There's also other forms of healing that we may do, which is ironology, which is actually looking at the pupil to find out which part of the pupil is either got marks on it, like it's brown spots or white spots, and we can determine exactly which organ is affected. We also have sun baths, as I stated, hydrotherapy, color therapy, where you actually have to look at a color and the patient will get better. Nutrition, as I practice, I will formulate teas for you or actually put a specific meal plan for you that will actually cure one specific illness to another. Now, I do believe as a naturopath that conventional methods do work. So if the patient is on a medication for as an antibiotic or is seeking other ways of healing, then that is fine. I would suggest you can use naturopathic ways or holistic ways on healing. But I still recommend that you please go and see your physician just in case if needed. Now, I will teach you about how to read a food label. Most people read the food label and says that it's just the calorie count or caloric count that you look at. It's not the caloric count. Yes, calories do count in some ways, but it's not just the caloric. You will look at fats, especially saturated fats, sugars, and yeah, mostly fats and sugars.